Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study that explores the causes of spinal cord disease, or myelopathy, in young dogs. It's widely known that in dogs older than 2 years, a condition called intervertebral disc herniation is the most frequent culprit behind myelopathy. However, the landscape of spinal problems might look quite different in younger pups, those 18 months old or less. This crucial area hasn't been thoroughly investigated until now. This research, conducted across 4 referral veterinary institutions, aimed to fill this knowledge gap by describing the common causes, how these conditions typically present, and what might be behind them in this younger age group. The researchers also sought to understand if specific clinical signs were linked to the most frequently identified causes of myelopathy. Their primary belief, or hypothesis, was that intervertebral disc extrusion would not be the most common cause of myelopathy in these juvenile patients. To conduct the study, the veterinary teams looked back at the medical records of 224 dogs aged 18 months or younger who had been diagnosed with myelopathy. These dogs had shown neurological deficits that pointed to issues within their spinal cords, as determined by veterinary neurology specialists. To be included in the study, a definitive diagnosis had to have been reached through further investigations. Importantly, all the dogs had undergone imaging of their vertebral columns, such as X-rays, computed tomography scans, or magnetic resonance imaging. The final diagnoses were made by carefully considering the dog's history, their clinical examination findings, and the results of these advanced imaging techniques. In some cases, additional tests like cerebrospinal fluid analysis, blood work, and even biopsies were performed to reach a precise diagnosis. The study population comprised a diverse group of young dogs, with a median age of 8 months at the time of presentation. Many different breeds were represented, but some stood out as being more frequently affected. Notably, French bulldogs were the most common breed, making up nearly 23% of the cases. Pugs also featured prominently, accounting for 8% of the dogs, followed by crossbreeds and English bulldogs. Interestingly, when the researchers looked at breeds known for having a screw tail, or pugs together, this group made up over a third of all the dogs in the study. After careful review of all the cases, the researchers identified a total of 31 different underlying causes of myelopathy in these young dogs. The top 5 most frequent diagnoses were vertebral malformation, which was the most common, affecting almost 19% of the dogs. This category included various abnormalities in the shape or structure of the vertebrae. Following vertebral malformation, the next most common were spinal arachnoid diverticulum, traumatic fracture of the vertebral column, atlantoaxial instability, and osseous-associated cervical spondylomyelopathy. Intervertebral disc extrusion, the condition so common in older dogs, accounted for only 4.5% of the cases in this young population. Now, let's hear from our second presenter as we delve deeper into the specific findings and what they mean.
Let's examine some of the key associations the researchers uncovered. One significant finding was the link between certain clinical features and the most common diagnoses. For instance, a final diagnosis of vertebral malformation was more likely in younger dogs and in those belonging to screw-tailed breeds or pugs. These dogs also often showed chronic signs of myelopathy that localized to the middle part of their back, specifically the T3-L3 spinal cord segments. Given that vertebral malformations are typically present from birth, it makes sense that they might manifest as problems at a younger age. The researchers also pointed out that the high prevalence of these malformations in screw-tailed breeds and pugs likely contributes to their association with myelopathies. Even though some of these dogs might live normal lives despite having vertebral malformations, the higher occurrence of these abnormalities in these breeds increases the chance of associated spinal cord issues. Another frequent diagnosis, spinal arachnoid diverticulum, also showed associations with screw-tailed and pug breeds. Additionally, dogs with this condition tended to have a longer duration of clinical signs that were often not painful. The exact cause of these diverticula, which are fluid-filled sacs in the spinal canal, isn't fully understood, but it's been suggested that they might arise from subtle instability due to vertebral malformations or from congenital issues. The fact that they were linked to the same breeds predisposed to vertebral malformations might support the idea of instability playing a role. When it came to traumatic fractures of the vertebral column, the clinical picture was somewhat different. Given the nature of trauma, the onset of signs was inherently acute. This diagnosis was associated with non-progressive clinical signs, meaning the signs weren't necessarily getting worse, and the dogs were often unable to walk. Notably, these dogs were also more likely to show pain upon examination of their spine. Atlantoaxial instability, a condition affecting the upper neck vertebrae, was found to be more common in dogs with a lower body weight, while interestingly, screw-tailed breeds and pugs appeared to be less likely to be diagnosed with this issue. This aligns with previous knowledge that this instability is often seen in smaller, toy breed dogs. The study also noted that the presentation of atlantoaxial instability can vary, with some dogs showing sudden, severe weakness in all 4 limbs, while others might have intermittent neck pain. Osseous-associated cervical spondylomyelopathy, a condition involving bony changes in the neck that compress the spinal cord, was associated with higher body weight. This is consistent with this condition often being seen in larger or giant breed dogs. It's crucial to remember that intervertebral disc extrusion, the leading cause of myelopathy in older dogs, was only the 7th most frequent diagnosis in this study of younger dogs. This strongly supports the initial hypothesis of the researchers. Interestingly, meningomyelitis of unknown origin, an inflammatory condition of the spinal cord and its linings, was not linked to any specific clinical features in this study. The researchers suggested several possible reasons for this, including that this diagnosis might encompass a diverse group of conditions with varying presentations, or that the number of dogs with this diagnosis in the study might have been too small to detect any significant associations. This study has important implications for veterinary clinicians. When faced with a young dog showing signs of myelopathy, the initial list of potential diagnoses should prioritize conditions like vertebral malformations and spinal arachnoid diverticula, especially in predisposed breeds like French bulldogs and pugs. This knowledge can help guide the diagnostic process and inform owners about possible treatment options and what to expect. The researchers did acknowledge some limitations to their study. Because it was a retrospective review of medical records, there was a possibility of incomplete reporting of certain clinical signs. Additionally, the accuracy of information regarding the onset and duration of signs relied on the memory of owners or the records from referring veterinarians, which might not always be perfectly precise. Finally, the study required a definitive diagnosis for inclusion, which might have slightly skewed the data towards more recognizable conditions. Despite these limitations, this research provides valuable insights into the causes of myelopathy in young dogs, highlighting significant differences compared to older dogs and emphasizing the importance of considering breed predispositions and specific clinical signs when approaching these cases. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.